Now, I now want to talk about mental health, because there were some, I'm going to call it vicious statements, viciously misleading statements. One person points to some of the early beginnings of kind of natural hygiene, and I'm not supportive of natural hygiene. You know, people 100 years ago and saying, well, these guys are nutcases. Well, I can't comment about the religious belief systems in the 1890s. I really can't, because it's a different world. But then it gets from that generalizing to all vegans and vegetarians are mentally disturbed. Now, these are statements that were made, okay, in the great health debate. Okay, they were really made, and I'm thinking, wow, you know. And so we get questions, is that true? Well, let's look at that. And I will tell you that, you know, as the only psychiatrist in this whole discussion, and as the only person with real, and one of the few people in the world who have actually looked at the question in a serious way, both meat eaters and plant source only people can have mental problems. I mean, that's fact. And the rate of mental illness is increasing exponentially. But I have to tell you, without giving a whole lecture on this, which I do in the master's program, it's more related to them taking medications than anything else. But let's just talk about the nutrition part. So let's talk about schizophrenia. In Russia, as a university at the Russian researcher, Dr. Nekoilev, they had 65%. They had serious people would not respond to treatment. They put them on a water fast for about the 28 days, 21 to 28 to 35 days. And 65% of the people became normal. Well, that's interesting. Then they discovered, and this is the punchline here, then they discovered that if they went back to eating meat, they became psychotic again. Now, I'm not willing to tell you eating meat makes you psychotic. This is not what we're talking about. But I am saying there's a whole group of people who do get mentally disturbed eating meat, and why? And I don't like to get too much into biochemistry. I mean, I wasn't trained as a biochemist in college, and I have my own laboratory and published papers in Journal of Biochemistry and Biophysics. The reason is that some people are slightly off and they can't metabolize the meat and produce 5 times more 6-hydroxyskitol, which makes you go schizophrenic. Okay, so there we go. You know, that doesn't mean that if you eat meat, you're going to go schizophrenic. We don't want to say that, but we do see that that does happen in a significant level, and the rate of schizophrenia is increasing. I'll also point out that meat eaters, as I point out in my book, Conscious Eating in 1990, have a significant deficiency in B3 and B6. And we know B3, B6, and B12 are very important in neurotransmitter production. And almost everybody who comes in for the mental health workup will be deficient in B3, B6, and B12. Meat eaters as well as plant source only, because we are dealing with a major B12 deficiency in our society because of the stress. Because stress will use up your B vitamins. Get that. So it isn't about how you take it in. It has to do with your ability to assimilate it. But more important, the power of stress is the dominant factor. So we see a lot of people. So that's another reason we see people, you know, having mental disturbances, is they're really low in their B vitamins. Meat eaters and plant source only. Again, I'm going to keep saying meat eaters because the way people slant it, they're, you know, because they're always trying to say it's your vegan diet. It's not that, okay? And I mentioned omega-3, long-chain omega-3 deficiencies. I want to again emphasize that in the United States, 70% of the general public, which is mostly meat eaters, are deficient in long-chain omega-3s. I will also say that 90% of the mothers, and I did repeat that before, but I'm making emphasis, are low in DHA. And when I treat depression in postpartum women, whether they were a live food person, vegan person, or meat eaters, I see the same problem. And when I give them DHA, their depression lifts sometimes within a few weeks. Even if they had it for 10 years. I've had a person with postpartum for 10 years depressed, and in 3 weeks their depression went away. Now, I want to point out again, people have misused the little bit of information, say it's a mental problem for, all the vegetarians are crazy. Well, it just isn't true. It is a Geneve dot. You don't know what that means. In Hebrew, it means stealing of the mind, misinformation. Oh, we did see it in that person. Therefore, all vegetarians are that way. Well, I could say the same thing about meat eaters. Geneve dot. I'm not going to. I think it's misleading and creates fear and confusion. So as a psychiatrist, as a person whose specialty is get it. It's everybody has, meat eaters do not have a problem with omega-3s. And we don't need to eat fish oil. Fish oil has 2% EPA and DHA. We get it directly from our diet, and we also get it from concentrates from golden algae. We don't need to go through an intermediary. So we, people who are plant source only, we have no problem. We do use concentrates because really the amount of it available in general is less and less. And when you go through fish, you're getting all the pesticides and herbicides. That's definitely a downside. Plus it gets rancid. That's definitely a downside. I don't really recommend the fish oils as a source of EPA and DHA. Now, one of the Pharaoh people said, oh, you cannot, nature doesn't have DHA and EPA. And that's just simply patently untrue. We know that there are personally, and this person's an herbalist, you should know that. But maybe we're doing, well, we'll just leave it that way. Purslane has plenty. I want to point out that alfanazon plus aqui, also known as blue-green algae, also known as E3 Live, has a significant amount of the long-chain omega-3s, DHA and EPA, and that's been tested, and they show when you take it, it increases the levels in your body. So it's right there for us. So we don't want to, it's just, people creating scare, you can't get it. You can get it, but I will tell you, particularly if you have a deficiency, you do need to take a supplement to make this thing work. And we have several golden algae supplement concentrates, and they work fine for treating not only depression, but also manic depression, okay, which is more of a genetic thing.